Now I got a kind of a disaster story here, and it's sad because it involves a death.
No.
But this story, this is this story. It's a disaster running into a dumpster fire, because as I dug into this, it just went from bad to worse.
Oh gosh.
So this is actually about a patient. This actually happened a year ago. When I saw it, I thought it just happened because it happened in October. It was October 2021, but now I guess like what brought it into the news was the fact that they're going after this doctor for what happened. And so this involves a Brazilian butt lift, which you guys know how I feel about BBLs. Like, I'm against them, and here's another example of someone dying after having a BBL. So this was a patient out in Florida that went to a center called Best You Now Plastic Surgery. And yeah, so I when I looked them up, I was immediately turned off. The Disneyland of cosmetic surgery.
Oh wow.
I mean, who would write that? Like,
Right.
I just is so, I don't know. It's just unprofessional. So this business is, in my opinion, a business that's a problem in plastic surgery, because I call these plastic surgery patient mills. Like, you've heard of puppy mill, where it's just like, high volume.
Yeah.
To me, this is a plastic surgery patient mill. I think I may be the only person that's ever said that. I may have coined a term. This video may go down as like, that's where the plastic surgery patient mill came from. But what they do is, this is a business. So it's not like me. So I'm a doctor. I have my own office. And even if I had partners, it would be Dr. Hermann and Dr. So-and-so's plastic surgery. But this is a corporation that opens up a facility that does a lot of high marketing and does really cut rate plastic surgery. And what they do is they do contract plastic surgeons say I don't have a busy practice, but I want to just do something, I can go and join this facility and they pay me like 25 cents on the dollar, which, it's not insignificant money, but not near as much as you would make if you had your own practice. But they pay these doctors like low amounts. A lot of times they do these things under local anesthesia so that they don't have to pay an anesthesiologist, and that allows them to basically do very, very cheap prices, which attracts people. And then they do a lot of marketing. It's like, oh, you can get your Brazilian butt lift for $3,000, which would be very cheap compared to like if I was doing that, which I don't even do those. And so it attracts people. And I have just a huge amount of problems with this. I mean, some of the problems, like, when you go to their website, it doesn't even have any information about their doctors, like zero information. Like, when you go to like a legit plastic surgeon's website, it talks about their credentials. Who are they? Where did they go to school? What is their training? What is their board certification?
Sounds like some back alley stuff.
I really have a huge problem with these places, and they are a really big problem in Florida. There's a lot of them.
For sure.
And it just, that was there's a huge warning bell. Like, when you go to their website and you can't even like look up the doctor. There's not even a name of a doctor. It's crazy. Also, like, they encourage medical tourism. Like, when you go to their form, it's like, is it possible for you to come in for a pre-op consult? But like, it doesn't like have any like kind of negative if you don't. Like, you literally could say, I want to get a Brazilian butt lift. Like, you could go on their website, say, my name's Sarah, I live in Texas, I want to get a Brazilian butt lift. And they're like, okay, we'll schedule it out. And then you arrive and like literally you go to surgery and have it. And I have a big problem with that because I think a lot of the mistakes that happen in plastic surgery are due to poor preoperative planning.
Yeah.
And this is just zero preoperative planning. I mean, they probably have something where like you go in and you talk to the doctor the day of, but like, I mean, at that point you're kind of committed. And so it doesn't give you that opportunity to make a plan in advance, which I don't like. And then also a lot of these places, like, the doctor doesn't see the patient post-op. It's like, a nurse or something that sees them post-op. So I have a huge problem with these places that pop up. And so this one specifically, so that's the first problem, that it's at one of these patient mill plastic surgery places. But the complaint is that this patient died and they were giving the patient anesthesia, but it wasn't an anesthesiologist giving the anesthesia, it was an OBGYN. Can you believe that?
Wow.
I mean, it's crazy. And so I looked it up, and they were doing, it wasn't like a general anesthesia where they put a breathing tube in and put them on a breathing machine, but it was like a level down from that, which means that they were probably getting like IV sedation. I mean, it's like a way to save money. Like, they don't want to pay for an anesthesiologist, so they just get whatever doctor to come in and do the anesthesia. And so that's why the state is cracking down on this place specifically. I mean, not even for the reasons that I mentioned, which honestly, I I think in the name of patient safety that places like this should be more regulated. I mean, when you can't even like look up the doctors or what their credentials are, it's worrisome. And they're doing the surgeries in the facility, which is a problem. If you go, so say you come to my office and I'm gonna take you to surgery, I take you to a accredited surgery center, okay? That means that there's a high level of credentialing that goes into like the doctors. Are they properly board certified and that kind of thing? When you do surgeries in an office, it's less regulated. So yeah, the patient had liposuction, had a Brazilian butt lift, had a breast augmentation.
She died in surgery?
No.
Oh.
So I try to dig up like to try and figure out what happened. Like the details of this are super sparse. At first I thought that the OBGYN was the one that did the surgery. I thought that's what happened, but I think it didn't. It doesn't really say, because in the whole article it says nothing about the surgeon. It's only talking about the patient died, and it's talking about the OBGYN. And I thought that maybe the OBGYN was the one doing the surgery. I mean, because that happens. I mean, there's a big problem with fake plastic surgeons out there. And I call a fake plastic surgeon as somebody who's doing a plastic surgery procedure that's not properly trained.
Yeah.
There literally are OBGYNs in Dallas Metroplex doing cosmetic surgery.
How do you know, like, what's
that's like
board
a whole,
certified? And
yeah. Yeah, and that's where it gets confusing. And I mean, honestly, we'll have to do a segment on that because it's even confusing for doctors.
Yeah.
So if it's confusing for doctors, like the average person like yourself or anyone looking for plastic surgery can easily, get led astray.
Yeah.
So we'll do a segment on that.
Okay.
I think we got our segments for the next show. What was the other one we were doing? Skin grafts.
Yeah, skin
Skin grafts and fake plastic surgeons. We got our next show. Nice. Anyway, so I think that there's some take-home points for this, and anytime that there's a death, I mean, we don't want to make light of it, and the reason we talk about it is we want this to not happen to other people.
Yeah.
And so, what can we learn from this to prevent bad outcomes in plastic surgery? Because as a plastic surgeon, I feel obligated to police my specialty. Like, I don't want people out there giving me a bad name. So in this instance, I mean, my number one problem is that this is a patient mill for plastic surgery.
Right.
I hate these type of businesses. I mean, to be fair, I've had friends who worked for them, like right when they get out of training, because they just didn't have business. They didn't have their own practice that was busy, and they needed to survive.
Yeah,
and
they
did
needed
it.
to work. Mm-hmm.
Huh?
They just needed to work.
They just needed to work, but I just feel like there's such potential for problems when you do that for the reasons that I specified. So I'm 100% against them, and people may get mad at me or whatever, but like at the end of the day, like I'm about patient safety. I don't want people to have injuries or deaths from plastic surgery, and here's an example of how that happened.
Yeah.
Also, I mean, you do need to do your own research. I mean, letting an OBGYN do anesthesia is just, in my opinion, criminal. I think that there's a failure of the facility to let that happen. There's a failure of the surgeon if there was one and it wasn't the OBGYN doing it. Like if I went into surgery and it was like not an anesthesiologist doing anesthesia, I would stop the procedure. I'd be like, okay, I don't feel safe about this. The nurses involved should do that. At every facility I work at, there's signs that say, if you're concerned, say something, which it's encouraging people that aren't necessarily the doctor or surgeon to speak up when they see something that's unsafe. And obviously that didn't happen here. And lastly, I think you should think hard before doing a Brazilian butt lift. I mean, since we don't have any details of what happened, we don't know if, was it the Brazilian butt lift that potentially caused the issue that caused them to die? Was it because that the anesthesia was done wrong? We don't know any details. We'll probably have to circle back on this as more details become available.
Yeah.
I'd like to know.
Yeah.
I want to know what happened. I mean,
we need to know.
We need to know because you want to know how to fix it.
Yeah.
Someone died. How do we fix this problem?
For real.
Yeah. Well, let us know what you think about these things. I personally think that these type of businesses are kind of risky. If you've had an experience, let us know. Was it good? Was it bad? I'd like to hear. So leave us a comment. Throw us a like and subscribe, and we want to hear from you.